Welcome back to my channel. This is your friend, Not Solution. Let's talk about top causes of stroke. A stroke happens when blood flow to a part of your brain is cut off. Without oxygen in the blood, brain cells start dying within minutes. To help prevent a stroke, learn about the causes and the things that can raise your odds of getting one. So let's talk about the types of stroke. A stroke can happen in two main ways. Something blocks the flow of blood, or something causes bleeding in the brain. An ischemic stroke is number one type. In 8 out of 10 strokes, a blood vessels that take the blood to your brain get plugged. It happens when fatty deposit in the artery breaks off and travels to the brain, or when poor blood flow from an irregular heartbeat forms a blood clot. You understand? Then we have the hemorrhagic stroke. This is less common than the ischemic stroke. And this hemorrhagic stroke is more serious, can be life-threatening. In this issue, a blood vessels in your brain balloons up and bursts, or a weakened one that leaks. And uncontrolled high blood pressure and taking too much blood thinner medicine can lead to this also, this kind of stroke. Then when we're talking about stroke, some people have what we call a transient ischemic attack. That's TIA. It's just a mini stroke. It's due to a temporary blockage, but most of the time it does not cause permanent brain damage. But what it does is it raises your odds of having a full-scale stroke if care is not taken. How can you causes? You can treat some kinds that make you more likely to have a stroke, some things. Other things that can put one at risk can't be changed. High blood pressure, your doctor may call it hypertension. It is the biggest cause of stroke. If your blood pressure is typically 130 or 80 or higher, your doctor will discuss various treatment options with you. Another cause is tobacco. When you're talking about smoking or chewing smoke, it raises your odds of a stroke, because nicotine in that smoke make your blood pressure go up. And cigarette smoking causes a fatty buildup in your main neck artery, and it also thickens your blood and make it more likely to clot. Even secondhand smoke, when you are staying with someone that smokes, can affect you. Heart disease condition include defective heart valves, as well as the atrial fibrillation or irregular heartbeat. They are all causes of quarter of all strokes among the very elderly in particular. You can also have clogged arteries from fatty deposits, so you have to watch your diet too. Then one of the causes is diabetes. People who have it often high blood pressure and are likely to be overweight. And both obesity and diabetes raise the chance of a stroke, because diabetes damage your blood vessels, which make a stroke more likely. So if you have a stroke when your blood sugar levels are high, this injury to your brain is greater as at that time. Then weight and exercises. Your chances of a stroke may go up if you are overweight. You can lower your odds by working out every day. Take a brisk 30 minutes walk or do muscle strengthening exercises like push-ups, you understand, walking with weight and all that. They all help out. And of course, there's some medications that can raise your chances of stroke. For instance, blood thinning drugs like I call the anticoagulant that some doctors suggest to prevent blood clots and can sometimes make a stroke more likely through bleeding. You understand? And of course, studies have linked hormone therapy used for menopause symptoms like hot flushes with a higher risk of stroke, and low dose of estrogen in birth control pills may also make your odds go up. You understand? Then, of course, one of the reasons too is age. Anyone could have a stroke, even babies in the womb. Generally, chances go up as you get older. They double every decade after age of 55 years. Then at times there might be family history. Stroke can run in families. You and your relative may share a tendency to get high blood pressure or diabetes. Some strokes too can be brought on by a genetic disorder that blocks flow to the brain. Then, gender, women are slightly less likely to have a stroke than men of the same age. But women have stroke at a later age, which makes them likely to recover and more likely to die as a result. You understand? Then race. Race, when we're talking about race, strokes affect African Americans and non-white Hispanic Americans much more often than any other group in the US. Then, of course, sickle cell disease is a genetic condition that can narrow arteries and interrupt blood flow, and is also more common in these groups and in people whose family come from Mediterranean, like the Middle East or Asia. You understand? So stroke is an emergency. Anything you're feeling you don't understand, kindly take a visit to your doctor. Bye and see you.